Thank you for choosing CTN. And now, it's time with Herman and Sharon.
I love you. Thank you for joining us. I know the red shirt is probably popping on television because there are very few people that wear red shirts. Do you ever notice that? Yeah, there are very few people that have guts to wear a red shirt, you know, especially on television. So, but I just thought I would do this today while Dave is staying on what I'm about to read here. It's very important. I have my good friend, Dr. Joe Cristiano, with us. Actually, it's our good friend, too.
Thank you.
You agree, too.
Thank you for including me, yes.
He's been our friend for years and years and years and years.
Yeah, we're just talking about that.
Yeah, I know, yeah. Which is great. You know, there's certain people that you trust, especially in this area, and when you find one you can trust, you just hang on to them. Dr. Joe Cristiano is a naturopathic doctor and certified nutritional counselor who spent 40 years developing individualized diet and exercise programs for Hollywood celebrities. I'm not finished. A trainer of Miss America, Miss USA. He has his Miss America sitting in our audience today.
He brought her this today.
Dr. Joe is also a former Mr. Florida, an award winner in the area of bodybuilding, and he, you know, even entered the ring of championships. Dr. Joe has also developed a nationwide campaign for helping kids with obesity and related illnesses and poor academics. I should have met him back when I was a kid, except he wasn't even born.
Yeah, that's right.
But anyway,
when are we going to see him?
I want to introduce Dr. Joe Cristiano. Take a look at him. There he is. There he is, right there.
Red shirt again.
I mean, and I didn't even send out a memo.
Red shirt day.
I didn't send out anything. And you should have seen us when I walk in the green room, because we always have prayer together in the green room, and I walk in and he stands up because he's a lot taller than I am. He stands up and I go, oh my goodness! And I was thinking to myself, yeah, but I bet your shirt does not have square buttons. So I go over and his shirt has square buttons.
You guys need to start your own, you know, red shirt club.
Like
the red hat lady.
That's right, the red hat lady. Yeah, you see that?
How could that have happened?
I know. That's a first.
Good taste.
I've got to tell you, it's the first. I mean, I've been on, when I used to wear shirts and neckties all the time or whatever, I've had, you know, the same tie sometime, but a different suit. But this is the first time shirt. But he also is an author of many books.
Yeah.
And this particular one, Living Beyond Your Chronic Pain.
Well, I can't wait to get into this because this is really interesting stuff.
I mean, if you get this book, I just want to kind of tease you a little bit on some of the subjects that are in that book. Now, we're going to cover another subject, but I just wanted you to be familiar with his books. And I remember your book on blood.
On blood types.
Yeah.
And
blood type, body type.
I've talked to more people about that, and you know, it's amazing. I would get a baked potato, you know, with cream when I get my steak or whatever, and after I would feel good for a while, and then I would be on my way home, and I'm going, you know, I really went down good, I thought. And then with the blood type, because he actually, if I had that video, I'd pull it up, but we don't have it available right now. But he actually gave me a blood test in the green room, which I pass out when I have blood tests. And so I was kicking and screaming and everything in there. And finally, they got the blood test so that he could determine B negative.
Yes.
And what blood type I was. And he told me, you should be having sweet potato with your steak. And ever since,
that's right.
I mean, it's been
ever since then.
Yeah.
It is amazing
new life.
how much difference when your blood type tells you what you should be, the category you should be eating.
Well, you know, we're setting a nutritional baseline. You know, we have all kind of ailments and symptoms, and we want to try everything under the sun.
Yeah.
Well, what we really need to do is start off with nutrition. In other words, what we eat on a regular basis. And if it's biochemically compatible, you know, for our genetics, then we have a solid foundation then to build on. Then we'll see things dissipate, a lot of the symptoms disappear, a few will remain. Now we can address those. And we always go to the root cause. And over time, we can eliminate, if not all of them, some of them, and feel a lot better.
Wow.
Yeah.
Well, in this book, some of the chapter headings, walking through the healing, remedies and solutions, and treatment options, on and on it goes. But get your copy, because you can go right to the website. We'll have it up from time to time. And in fact, that way you can make yourself available to all of his books and understand where he's coming from. But this is going to be unusual today, because we're talking about adult stem cell therapy. And
I've heard a lot about it lately.
Yeah.
Explain, and then we're going to walk through some of the health benefits, the stem cell treatments, and just kind of the back part of what happens with the stem cell treatment.
Well, stem cell treatment is really dealing with our own ingredients. In other words, when we go through stem cell therapy, there's no medications or additives added. It's from our own blood. We make a blood draw, and then they prepare the blood. And there's three different areas. There's actual stem cell therapy, there's PRP, and then there's activators, stem cell activators, which are not drawn from the body but added to the body.
You said PRP.
PRP, yeah, that's platelet-rich plasma. And what happens, let me start so I don't get ahead of myself, but the demand for answers when it comes to orthopedic problems, arthritis, rheumatoid arthritis, you name all these different diseases that we deal with, joints, knees, back.
Lyme disease?
Yes, Lyme disease, but structural.
Yeah.
Knees,
more structural.
Shoulders, back, necks, and things like that. How can we get to the root cause and avoid surgeries? Because typically, what happens is you have this pain and it becomes chronic. It goes from acute, then it lasts for weeks and months, and now you're limited to what you can do, and you're in pain all the time. And of course, we go to our physician, and what do we receive is medications, and that really masks the problem. And it does give us some relief, but when you weigh the difference between the bit of relief you get, because you never get 100% relief, versus the side effects, we really need another way to go about this. And so scientists through the years have understood that we have within us adult stem cells in every tissue and every organ in our body. And what happens to the stem cells over time is, just through the aging process, disease, environmental pollutants, and things like that, these stem cells start to go dormant and they start to die off. And we got to understand stem cells actually communicate with one another. They signal. In other words, the stem cells of a heart or a pancreas or the liver or kidneys or lungs, they have a job to do, and they tell each other, hey, they tell them heart things, they tell them lung things. This is what we do. We're a team. But when some of the team members start to fall off, there's a miscommunication in the signaling. Then all of a sudden, that particular organ or gland starts to break down, and we have these symptoms, and then we start approaching it from a medical approach. And unfortunately, what we need is more stem cell rejuvenation. We need tissues that need to be rejuvenated and repaired. And so stem cell goes right to the root cause.
Have you ever had this yourself?
I've had it done many times for myself through all the years of competition and bangs on my neck and my head and back and hips. And for example, I had PRP. PRP, it's a very simple process. You go in and they do a blood draw. Okay, they draw your blood and they spin it, they harvest it, and it takes about 30 minutes.
Why the spinning?
Well, they separate the growth hormones and the platelets, and they make it very, very potent. And from there, then they put it into a syringe or syringes based on the site, if it's a shoulder, a joint, or if it's a back or joints in your back or knees.
Is there a particular location of the body you always go to?
Well, it depends what's damaged. It depends where your problem is. A lot of people have knee problems, particularly as we get older. The meniscus starts to wear off. You hear the term, you're on bone to bone. You're on bone to bone. We've done the MRIs, and now instead of having that protective cartilage, it's all worn through, and now every time you move, that bone touches on the other bone, and it creates an inflammatory response, and now you're inflamed and you're in pain, and you're taking pain meds or anti-inflammatories for that. But the problem is you still have the problem. So when you take when you have stem cell therapy, they'll inject the PRP or the stem cell.
And it's from your own body?
It's from your own blood, yes. The PRP is from your blood, and they'll inject that. And that's a good way to start. Now,
is that painful?
No, it's not painful. I've had it done many, many times. If I can describe it one way, other than the little prick of an injection, and if the administrator is very good.
Well, how do they take the stem cell? I mean, when they take
the PRP. The PRP comes from the blood. It's been prepared, and it's in the syringe.
So then you have to, what, get a vial of blood?
Yeah, they draw it into the syringe, and then they inject it, say, into the knee or into the back, into your neck.
You mean right then?
Right then. It's in and out. You're in and out. You're through in a couple hours. And you go home, and some people feel better immediately, and sometimes it takes a couple weeks to a couple months for full repair.
Does that rebuild your cartilage around your knee, or what?
Exactly. That's what it's doing. Because what's going to happen typically is your orthopedic surgeon is going to do what they do, and that is saying, we need to do knee replacement. We need to do hip replacement.
Right. Sure.
And you don't know the difference, and so that's what you go for. And an MRI doesn't give us the biological cellular conditions. Well, when they cut a bone off, there's still biological tissue there. And these cells, if you can get stem cell to them, because we've got to remember now, our joints, the knees, the spine, things like that, it has very, very low flow of blood and oxygen, so it can't heal. So that's why they dry out and they become rickety and painful.
Now, does exercise, like I have since, 20s.
Yeah.
Okay, and I'm 77, so I've exercised a lot. Does that either wear it out, or does it keep it coming?
No, I mean, you're able to get the synovial fluid that's in the joint. It's designed to be there. And by not exercising, you create a very dried up joint. That's why arthritic conditions are so prominent in people that are inactive. Okay. Activity, you'll know this. If you have arthritis, you get out of bed in the morning and it's painful to start walking, but once you start making 20 or 30 steps, everything kicks in because the synovial fluid is starting to lubricate the joint. But when we're on bone to bone, then we don't have that cushion.
Right.
Stem cell or PRP will go in there and it starts to rejuvenate and repair the damaged tissue.
So let me ask you this. That would eliminate a knee implant or a hip implant?
Replacement, sure.
It would eliminate that?
Eliminate the surgery, yes. Now everybody's case is different. Now we got to understand that if you're chronic for 20 years, you might be on repair.
Correct.
Okay, but that's not the case with most people. And so PRP is a great way to start. I had it done in my neck, and what happened is I had injured my neck, and I had a subluxation where my nerve in my neck was pinched around the S7, or C5 and 4, and it was radiating down my shoulder, into my forearm, into my fingers. I mean, so bad that it was like a burning sensation 24/7. I was exercising, and I was on a bench press. I could use 70-pound dumbbells, press.
Wow.
When that occurred, I couldn't press 10 pounds because the pain was so excruciating. So I went to a physician.
And you probably couldn't sleep.
No, I couldn't sleep anything. I mean, 24/7. It's just like I got a vice grip, a pair of pliers, and pinched your nerve and didn't let go. Wow. And you start to sweat, and and it's like that. Well, I had some nerve damage, and what was happening is you have triceps, and that's 3 muscle heads. Well, the back one is nearly gone on mine because the longer that nerve in the spinal cord, wherever it is impinged, and people live with it and they take pain pills. What happens is you're having permanent nerve damage. That nerve sends electrical currents to that organ or that limb or that muscle group to activate, to be active. Over time, it'll kill it off. So when I went to the physician, he says, listen, this is going to take about 2 months, and you're going to be in some pain, but it's going to take care of itself. So I went in and had one treatment. He said, I'd like you to come back for a second.
No, so he injected?
He did the extraction and did the PRP, and you tip your head forward because your spine can open up a little bit. And all he does is inject into the joint, but not into where the nerves are. So there's nothing like that. And the only sensation I really had and experienced was as if I was having a balloon being filled up. My joint was filling up with the blood. Wow. And the blood is what we call the medicine, but it's not medication.
Now, not every doctor does this, right?
Not every doctor, but those that are trained, and more across the country are becoming more and more familiar with it because this is the trend. Now, I shouldn't say trend. This is the future.
Yeah.
This is the future for orthopedic.
God made the body, didn't it?
It's amazing.
I mean, to repair itself.
Amazing. Yeah, absolutely amazing. Now, science is catching up to our Creator.
Sure.
Somewhat.
Sure.
Okay? And now we can take elements from our own body, re-inject them into the body where we're damaged, and not only do you have relief of pain almost immediately in most cases, but the tissue is being repaired. So all these tissue like the meniscus, the soft tissue, ligaments, they start to grow. They start to come back.
Did you feel that happening?
Well, in 2 months, I was looking at and visiting a neurosurgeon to have surgery on my neck, and he did the whole rigmarole and said, you don't need surgery. We can maybe do an epidural and kind of, cortisol. In other words, get rid of the pain, but not the problem.
Sure. I
said, I'm not going to do that. Shortly after that, which was 2 months, almost to the day, all of a sudden I woke up, I told Lori, and I said, you know something, I don't notice any more pain. And believe me, I went from excruciating pain to no pain, and haven't had a problem since. I've had it in my lower back. And again, it's very interesting that when you have PRP, okay, that's only coming from your blood, your own blood, nothing added to it. They inject, they may lay some warm pads on it for 20 minutes after you're through, send you home, you're done. Now, stem cells are a little different. Stem cell is much more potent. Okay,
does that hurt?
Same procedure. No.
Hey,
same. I know how you are with pins and needles. Right? I tell most men, look, just hum the theme from Rocky, okay, and you'll be all right. You'll get through this, all right?
You're gonna live.
But stem cell, now this is different. Now stem cell comes from our blood, comes from bone marrow, or body fat, okay, adipose tissue, and in the adipose tissue, there's hundreds of millions of more stem cells than in any of the other. Now, this is totally different from embryonic, stem cells from embryonic cords. We're not talking about that at all. We're talking about your own. Now, what they've learned and what they do is they'll do a mini liposuction. And I mean, it's not a cosmetic procedure. Yeah. They'll go in and they'll start to do a mini liposuction and pull out body fat.
For the stem cell.
To extract the stem cell and prep for re-injecting.
See, if they were doing that, I'd just say, just go ahead and keep doing it, because I want to get
you love that. Yeah, sure, go away a half inch smaller, something like that. But the beauty of that is that there's a mesenchymal stem cell. That's the one that has the greatest differentiation. In other words, when you inject stem cell into the body, it travels to every place, okay, in the body.
Throughout the body.
If you have an infusion, if you have that stem cell injected into you, okay, and it travels throughout the entire, systemically, throughout the body, and wherever.
Do you feel it?
No, wherever there's damage, could be your liver, your kidneys, your lungs, whatever has been deteriorating through the years from trauma, from accidents, from disease. These little Pac-Men go in there and they bond with the beta cells and they start growing new tissue. We have people that have had major cardiac arrest, half of the heart destroyed, and have stem cell treatments and restore the entire heart function.
Will it help the liver?
Of course it helps the liver.
Well, how come you don't hear more about this?
Because they're far and few between, and some of these procedures have to go out of the country. And the reason for that is the FDA has a hand down on everything because, well, I want to be careful how I say this. You know, if
they want to make more money.
Okay, he said it, all right? And not only that, is if we have a cure, there's a big segment of the medical community that's out of business.
That's true.
So that's why a lot of your MDs...
Pharmaceutical.
Yeah.
Bingo.
Yes, and that's causing more problems. In fact, when you take pharmaceuticals like opiates for pain, there are more deaths related to opium than heroin. And we have a major heroin problem in the United States.
Yes, we do.
Opiates. I was on them. When I was, I've been banged up for 7 years, and I ended up in a walker. And when I made that decision, you got to understand, when a person is in chronic pain, and I mean 24/7.
You'll do anything.
Yeah, you'll do anything. Yeah. And if this glass of water took the pain away, I'm carrying this everywhere I go.
Yeah.
But,
and you're not going to ask what's in it either.
No, I don't care what's in it, right? But I did care. And so what I did is I made sure I fortified my liver and my kidneys while I was taking this stuff.
Would this help cancer?
Absolutely.
In the body?
Yes. Yes, it does. And the reason why is that the same principle, the stem cell is injected right where the cancer is. Wow. Okay? There's a gentleman out of Orlando, Florida, that's a very, very visible person, and he had a terminal brain cancer. He went through every modality. He went through medical, pharmaceutical, natural, and the only thing that saved him was stem cell injections, and he doesn't have brain tumor anymore. Okay. So what we see with PRP, you know, that's the least expensive, and the procedure is the same as stem cell, but stem cell is powerful. It doesn't only heal and repair; it grows new tissue.
And it's your own body.
It's your own stem cells.
Now, what type of doctor would you go to? I mean, to start
an MD.
Just an MD?
DO?
No, not some DOs, but an MD and you know, your orthopedic surgeons that.
Do you have their names? Do you have the names of doctors like in Orlando that? I mean, if I called you.
Yes.
You would have a name.
Okay. In fact, I am building right now, I didn't know I was talk about it, but I'm building a physician directory. It's going to be online so that people all over the world that are in
So they could go to your website.
And they can, and I will recommend 2 or 3 from the state of Florida, from the state of Georgia, throughout the country, and say, these guys are the best in the business.
Because you've researched them.
Yes, yeah.
That is smart.
Because we get people calling all the time with pain. I mean, they see my book that I talk.
Yeah.
I talk extensively about that.
Well, you're talking from experience.
Yeah, absolutely.
Most people read books and go to studies and everything, and they've never had it.
Yeah, no, I know. I went to Honduras. I went to Honduras to have treatment. It cost me about $15,000 to go to Honduras, and it was for my hips. The problem with my hips and the procedure I had was, at the time, those who were doing the procedure were excellent. I was so far advanced. Probably 12 years before I decided to go to Honduras, a orthopedics group told me, you need hip replacement therapy or replacement.
I remember a few years ago walking to the set. You were walking like this.
Yeah, I know, it's terrible.
Remember?
Now, wait a minute.
And I don't remember walking like that. My wife would always remind me.
Oh, yeah.
And you know something, that after all those years of learning to walk that way, you know, you're forced to walk this way.
Yeah, your brain.
The brain readjusts and tells you this is how you walk. So once I had to have bilateral hip replacement surgery, because I could not separate, if I were standing up, I couldn't separate my feet more than 6 inches. They wouldn't move without excruciating pain. And my wife, for 3 years, tied my sneakers for me. I couldn't reach down. I was immobile. When my doctor told me, he says, you're handicapped, and you've got to understand that. That was like a major blow. I said, I'm not handicapped. And when I started thinking about it, I was hanging on to everything just to walk. I ended up in a walker.
Now, you said Honduras. I wouldn't think you would go to Honduras for anything.
Well, I have an associate that has a clinic there, okay? We were in Tegucigalpa, all right? We weren't in the jungle, but it is kind of a scary place to go.
Yeah.
But we were guarded and everything like that, and it was fine.
They like to kidnap you for $1 million.
Yeah, but they figured they saw me limping in. That I wasn't worth anything. Let this guy go.
Make sure you don't wear any expensive jewelry.
Yeah. But the beauty of stem cell is we're seeing.
We got 5 minutes, just so you know.
Oh man, because I want to talk about stem cell activators.
Yeah.
Okay?
In fact, can you put that up on the screen just for? Because I know you've got it on the screen, and we can kind of get a close up of the product. Yeah. Okay. This right here. You should have a picture of this. Have we got that picture? Okay. He's coming up with it, where you can actually see a close up, because we have. There it is, right there. And you have a picture of all 3 of them too, Dave.
Yeah.
Okay.
Well, those are just 3 different types. We have them for the pancreas, for people who have diabetes or blood sugar issues.
Yeah.
Let me give you a quick story. My mother, 91 years old, a year ago was,
hold that on the screen.
Saw her physician. She was having failing kidneys. They're down to 25% function. He said, you better start talking to your family about dialysis, because if they start going south anymore, you're going to have to be on.
And she was what age?
90 at the time. And she also has diabetes, okay? And I said, Mom, here's what I want you to do. I want you to start taking the 2 different stem cell activators. Now, these are stem cell activators, not stem cells.
Okay.
They activate and rejuvenate your own stem cells that you already have in your body. In this case, it was targeted for her.
So you drop it in water?
You drop it in water, about 15 to 20 a day, based on your condition. And usually you go maybe 15 to 20 minutes before and after eating or drinking something. Do it separately. But I told her, I said, I want you to start this. And so she took one that was targeted for the pancreas, for her sugar, for diabetes. The other was for her kidneys. 3 months later, she tells me, I just come back from the doctors, and here's the report. The doctor that was treating her for the kidneys said, I don't know what's going on, Helen, but your kidneys seem to be turning around, so let's forget about dialysis and see what goes on. And then her doctor that was treating her for diabetes had to cut her insulin by 50%. And this is a 90-year woman.
Wow.
Come on, not a 70 or 50 or 30. And now, a year later, she's taking these all the time. She calls me, Joey, you got to get my stem cell activated.
So they can go to that website and get this?
They can go to the website and get these, yes. And we have them. We have 23 different types for liver, for lungs. We have people that have had injuries, okay, like a sprained knee or something like that, and they start taking them. Within weeks, it goes away. I take them. From the years of powerlifting and bodybuilding, you know.
Now, which one would you take for the knee?
It's called CNT. You'd have to call and just ask, and we can refer you to
just say I've got a problem with my knee.
Kidney support. This says here pancreas, and this is bones.
Yes.
Skeletal.
Skeletal.
That's what I need. That bone.
But let me tell you something. We talked about PRP. Now PRP is probably anywhere around $500 to $700 a treatment. Stem cell is anywhere from $5,000 to $10,000 a treatment. No insurance, doesn't cover it. These are $50.
Wow.
And I thought to myself, when I worked with the scientists that put these
you
together.
Mean per?
Yes.
Okay.
Yes, $50. Okay. Yeah, but let me tell you
something. So you got 150 right here.
Within well, if you bought 3 of them.
Yeah.
But if you have a problem that we're talking about, whether it's joints, whether it's kidneys, lungs, heart, liver, it doesn't matter. I would recommend you start here, because what these do is you put them in water, and they are targeted. They are programmed to go right to the particular gland or organ. Wow. And what they do is, I was saying earlier, our stem cells start to die off. They become dormant from age, from disease, and illness.
Yeah. Well, tell me about it.
Okay, so now when you start taking these, they rejuvenate them. They bring them back to life. And before you know it, the symptoms dissipate. And I'm seeing this happen completely. We just started this here, and I wish the world knew about it, because one, I can save them thousands of dollars, and two, this here is a perfect way to start to heal your body.
Linda Opsahl, book him again. We got to have him back, because I didn't know it was going to be this good. I would have another one right behind it. Okay, thank you.
Should we wear red?
Yeah. Let me give you a notice next time. Yeah. The next one is going to be green. Okay.
There you go.
But spend time in God's Word. Read at least 2 chapters every day. Pray at least 15 minutes. I used to say that for years, and I had a woman at the telethon. She said, "I have never stopped doing that, and you used to tell me to do that years ago. So I'm going to start it up again." And I do. I read through the Bible every year, but read at least 2 chapters every day and pray at least 15 minutes. You can do that, right? Because Jesus Christ is the answer to every need you may have. God bless you. Bye-bye.
Thank you for watching It's Time. If you have recently made a decision for Christ, Herman and Sharon would like to hear from you.